Hello, my good people. We are still discussing about sexually transmitted diseases, and we are covering conditions which lie under sexually transmitted diseases. Remember, this is sexually transmitted diseases, not sexually transmitted infections or UTIs. Remember, yesterday we said that a sexually transmitted disease can start with a sexually transmitted infection, but the two are different. Before we continue, let me thank you people for the continued support that you are showing me. We are at 8,000 subscribers. The channel is growing rapidly. And let me encourage those who have not subscribed to continue subscribing, to share our videos so that they may reach as many people as possible, to like and more so comment. So yesterday we discussed about pelvic inflammatory disease as one of the sexually transmitted disease, and it originates from a sexually transmitted infection. In this video, we are going to discuss about what we call tertiary syphilis. I remember some days ago we covered this topic about syphilis. So I know to most of you I'll be making a revision or doing what I already did in the past. So in tertiary syphilis, the early stages of syphilis, which is very common infection, are considered as an STI. The early stages of tertiary syphilis, which are very common, are always considered as an STI. Remember, we said that most of the sexually transmitted diseases start as a sexually transmitted infection. So, infection first appears as one or more small round sores, one or more small round sores on genitals, anus, and mouth. If left untreated, syphilis will move to the latent phase, which has no symptoms. Remember, when we were discussing about syphilis, we covered about all the 4 stages of syphilis. And for those who never followed me during that time, you can go to my channel and you will find that condition well discussed there. So, a point to note, syphilis can have serious consequences for several organs. Syphilis, if left untreated, can have serious consequences for several organ systems in the body, leading to 1. These are the complications or the repercussions that can come about if syphilis is left untreated. 1, we have loss of vision, the eyesight disappears. We have hearing loss, we have memory loss, we have mental health conditions, for example encephalitis. We have infertility of infections of brain, spinal cord, and heart diseases. Another point to note, the earlier the syphilis is diagnosed and treated, the less the damage. This is in all conditions. If a sickness is diagnosed and treated earlier, the complications or the effects will be less compared to if it's left untreated for long. So, the earlier the syphilis is diagnosed and treated, the less the damage it does. So, while penicillins injections are typically used to treat tertiary syphilis, this means the drug of choice for syphilis is penicillin injections. So, even if these injections can be used to treat syphilis and remove the bacteria from the system or from the body, they can't reverse any damage that has already occurred. This means the penicillins will eradicate or kill the bacteria from the body, but they can't reverse the complication which has already occurred. So, if the disease causes problems with major organs like the heart, if the complications brought about by the syphilis injections are major, like in the heart, other medications and procedures may be required alongside with the syphilis treatment. So, another disease we are going to discuss about in these sexually transmitted diseases is what we call cancer. So, although some strains of human papilloma virus tend to cause non-disease, other strains cause abnormal cell changes. I want you to get this very clearly. Although some strains of human papilloma virus tend to cause non-disease, other strains of human papilloma virus cause abnormal cell changes, and this can lead to cancer, including the following: 1. Oral cancer, 2. penile cancer, 3. cervical cancer, and 4. vulval cancer. Then the last one, anal cancer, is anal cancer. That is the last one. So we have when the strains of human papilloma virus tend to cause these diseases. This means that some strains cause no diseases, but other strains cause abnormal cell changes and can lead to cancer, including the following parts: oral cancer, that means mouth cancer; penile cancer, obvious the penis; anal cancer, obvious the anal region; cervical cancer, obvious it's the cervix; vulval cancer, cancer on the vulva; and also the anal cancer. So, as per the National Cancer Institute, human papilloma 16 and 18 mostly cause cancer. So HPV 16 and 18 mostly, as per the National Cancer Institute, most cancers are related to human papilloma 16 and 18. So, human papilloma virus causes almost all cancers. I want you to get this. Human papilloma virus causes all cancers, as well as 90% anal cancer, 75% vaginal cancer, 60% penile cancer. Symptoms vary depending on which part of the body is affected. So the symptoms will vary depending on the part of the body which has been affected by cancer. Swellings, lumps, bleeding and pain are common in this kind of disease. Note this: if cancer is diagnosed early, it can be treated by chemotherapy. So, in conclusion, I was saying this, and this is very important. If cancer is diagnosed early, it can be treated by chemotherapy, radiotherapy, or surgery. Some screening tests exist. To detect precancerous cells changes caused by human papilloma virus. Some screening tests exist to detect cancerous or precancerous cell changes caused by human papilloma virus. This marks the end of our first video today, and in our next video we will be discussing about the same topic about the diseases, sexually transmitted diseases in pregnancy and others. So let's continue subscribing, liking and sharing our videos to reach as many people as possible. Thank you for the support. Good day.